Hello, I'm Dr. Nancy Silva, and I'm starting a new series discussing the newborn hospital exam. Many parents just want to know, is my baby okay, and can we go home? And that's the typical response, and most of the time the answer is yes, and there's no issues. However, I thought it might be nice to know what actually is your pediatrician looking at when your baby is in the hospital. In the end, we're actually looking at a lot of details. The first thing actually is we take an overall look of your baby. The next thing I usually zoom in on is heart, lungs, and abdomen. That's basically your core, and we want to make sure that's okay. So what do we look at? I'm going to listen to your baby's heart and make sure that there is not a heart murmur. Most of the time, if there is a heart murmur, it's something pretty simple. Very commonly, what's called a PFO or an ASD. A PFO is a patent foramen ovale, and an ASD is an atrial septal defect. Most of these things self-resolve on their own. We do recommend following up with a cardiologist, and they follow and make sure that it disappears. And that's because once your newborn takes that first new breath, usually there's a flap that closes, and the little tiny hole that was there served its purpose for in utero circulation. However, once your baby's born, takes that first breath, the flap closes, and usually those little holes are disappeared. But it doesn't always happen that way, and it takes time. If it is something serious, usually the cardiologist is going to be able to find that out on an echocardiogram. That may or may not be necessary to be done in the hospital. Most of the time it's done outpatient, but it all depends upon what we hear and what we find. The other thing we examine is part of the heart, which you may find odd, but you might find that we're actually putting our two fingers and checking what we call the femoral pulse. So it's actually on either side of the groin. And so I've had people go, what are you doing there? What are you checking? And I said, well, we have to make sure we feel a femoral pulse because we want to make sure that the circulation is going from head to toe. And they don't have the best circulation, as everybody knows. That's why their hands and their feet are cold. But if you have femoral pulses, that usually means that the circulation is intact. The other thing that gets done, and this isn't by me, but this is before discharge and after the baby is 24 hours old, it's what's called a newborn oxygen saturation test. And typically they'll put a pulse oximeter, which is a little thing basically that goes on the finger and goes on the toe. And that makes sure we catch anything that we could have missed. Not every murmur or not every critical heart condition can be heard as a murmur. That can catch things that we might not otherwise find, such as coarctation of the aorta and a lot of other complicated situations as well. The next thing I'll be checking is lungs. I want to make sure that all the lobes are aerating properly. This is especially important in babies who had passed meconium in utero. Meconium is basically your baby got stressed and your baby pooped. Why would your baby be stressed? Well, because your baby is about to be born, and that's a stressful situation. All the contractions, all of a sudden the home is like getting an eviction. So that can happen, and also other stressors during the delivery can make a baby pass meconium. If the baby inhales it, it could be called a Meconium Aspiration, and it can then develop into a pneumonia. So that's something that we listen very carefully to make sure, is that present? There's something else called Transient Tachypnea of the newborn that is very common, and again, it usually passes on its own, just some time, but it's a very high respiratory rate. So we would need an x-ray. We would also be auscultating to make sure, are we hearing everything okay? The last thing in this video is going to be talking about the abdomen. So we will palpate the abdomen, starting from the bottom all the way up, and we're also looking. So many times, there might be certain situations that make us pause. So what are we palpating and feeling for? We want to make sure that we don't feel anything that we shouldn't be feeling. And so what does that mean? We don't want to feel a liver. We don't want to feel a spleen. We just want to feel soft abdomen, nothing hard and nothing abnormal. The other thing that we look for is, what is the hernia looking like? That's right. All babies are born with an umbilical hernia. That's why you'll see that the cord is loose. So there's like a round area that you'd be like, oh no, that has to close up. Why is that like that? And then we also call it a ventral hernia, that typically from the belly button, like if this is your belly button, then all the way up, that abdomen hasn't had a chance to really have the muscles tighten in yet. So there's a bit of an opening. And that's very typical. So we will examine it, we'll check if there's any discoloration, we will palpate it again and make sure that everything we feel is soft, and typically it's soft and bubbly. Every once in a while, we do find out that this is bigger than we thought. There's something like a mass there. And so typically that's called an Omphalocoele, and that requires surgery to correct it. Hope you find this helpful. Please subscribe. Please follow me on social media. Let me know what you liked about this. Let me know what other topics you'd like me to discuss, and stay tuned for the next video. Thank you. Until the next time, have a good one. Bye-bye.